Combating the Flu. Tonight's presenter, Dr. Nicole Agcanas, is a board-certified primary care physician specializing in family medicine. She is a graduate of Albert Einstein College of Medicine. Dr. Agcanas practiced at Montefiore Medical Center, Moses Division in the Bronx, New York, of course, before we were lucky to have her joining us in the Hudson Valley community. I want to thank you, Dr. Agcanas, and the team of Montefiore St. Luke's for partnering with the Cornwall Public Library to put this valuable program together. It can't be any more important this year than in all other previous years to discuss combating the flu. I also want to give a special thank you and a shout out to Kevin Venkatash, the marketing coordinator at Montefiore St. Luke's, for all his assistance in making this possible. No one person puts a program together. So thank you, Kevin, and for all of your efforts and your colleagues' assistance. So thank you, everybody. Wishing everyone a very happy and a healthy season. So Dr. Agcanas, it's all yours. Thank you.
All right, thank you so much. Thank you for that introduction. All right, combating the flu. So I just wanted to go over an outline of kind of what I would be discussing today. So kind of the flu 101 is what I mean by that is just like the basics. So symptoms, why is talking about the flu important. The other thing I find probably in this time period is the differences between flu and other viruses that could be going around this time. Treatment, prevention, kind of common questions around the flu vaccine. So it is a respiratory virus caused by something called the influenza virus. There are actually two different types, type A and type B. And within those two types, there's multiple different subtypes, and those are always changing from season to season. It's something that generally infects the nose, the throat, sometimes the lungs, which is why we get those certain symptoms. And your illness can vary from something very mild to something very severe. And this cute little virus on the side is actually an image of a flu virus. So when is the flu season? So actually, the flu can actually happen throughout the year, but there are different times of the year that flu or the influenza virus is more prevalent. So typically, usually beginning in October, with peaks in December to February is usually when we see our highest numbers. And then also, I would say last year, I was getting numbers from the CDC to estimate like how many people were actually getting sick with the flu virus. So by their estimates in the last flu season, so 2018 to 2019 flu season, there was an estimated 35.5 million people that actually were sick with the flu virus. And then 16.5 of those needed to go to their healthcare provider because of the illness. About 490,000 of them were hospitalized, and about 34,000 deaths were from flu. And we'll talk about this later on in my presentation, because the numbers are actually much different this year, and that's probably because of the measures that we're taking with COVID. So some very common symptoms that all of us, I'm sure, are aware of. So fever, or just feeling feverish or having chills, runny nose, stuffy nose, cough, sore throat, body aches, headaches, just feeling generally tired. You can actually have vomiting and diarrhea, although these symptoms are typically more common in younger children. And then for flu, not everyone has fever. Some people may have low-grade temperatures, but typically children end up having more fevers than adults, and their fevers are usually higher than adults, sometimes even getting into like the 104 temperature range. And how do we spread it? So most scientists believe or have studied this and find that it's through tiny little droplets, so mostly spread through when people like cough, sneeze, talk, and then those virus particles go into those little droplets, and then anyone nearby can have them absorbed into like things like their eye, their nose, their mouth. It's less often spread through contact through surfaces that have the virus on it, and that's just because of the nature of the virus and how long it can survive on hard surfaces. And most people, when they do get infected, start showing symptoms around 1 to 4 days after infection, but still can be infectious prior to their symptoms. So like 1 to 2 days, you can start to actually be infectious. They found that most people are the most contagious around day 3 to 4. However, that period can be up to 7 days of being infectious. And actually very young children, so more like infants and people that have like a suppressed immune system, actually can stay contagious for even longer. So for most people, you know, the flu might last for a few days, for up to 2 weeks actually. And, you know, you feel very crummy, you might have to stay home from work or school, but you get better. But there are some times that people do get complications from the flu. So the most common being like ear infection, sinus infection, pneumonia. So these are usually bacterial pneumonias after having the virus. Dehydration, typically this is more an issue in young children. So young children aren't really able to keep up with how much hydration they need, or some of the older population also same way, because they are not able to keep up with their hydration status. And then in very, very severe cases, you can develop something with severe inflammation of the heart, which is called myocarditis, or brain, which is called encephalitis, or muscle, which is called rhabdomyolysis. And in very, very severe cases of your body's response to the infection and inflammation, you can get something called sepsis. They're at higher risk, in particular, it's kids younger than 2. People that have underlying lung diseases like asthma, COPD, interstitial lung disease, or even those with chronic illnesses like sickle cell disease, diabetes, chronic kidney disease, heart or liver, and even in those that are overweight with a BMI over 40. And we find that's because they have a lower immune system, so their immune system can't fight the virus as well. And some other things there like neurological and neurodevelopmental illnesses, HIV, cancers, commonly folks that are on medications that suppress your immune system like chemotherapy, or if you're on chronic steroid use. If you're pregnant, you're actually at higher risk as well of complications, and that's also because your immune system is just lower when you're pregnant. And then nursing home or long-term living facilities. And there's even some evidence that certain ethnic populations or groups are actually at higher risk. So non-Hispanic, Black, Hispanic, or Latino persons, American Indian, or Alaska Native persons also are at higher risk. So I think it's also kind of, when is your symptoms an emergency? So in children, it's important to, you know, monitor your kids. The things that you would look out for to send you to the emergency room or to speak to your provider immediately would be fast breathing or trouble breathing, like bluish lips, ribs pulling in with each breath. And what that means is if you were to lift the kid's shirt, you can actually see their stomach is kind of pulling in. Any chest pain or really severe muscle pain where they refuse to walk. If you notice there's no urine for 8 hours, they have a dry mouth, or when they're crying, there's no tears, that's generally a sign that they're dehydrated, and they probably, at the very least, need fluids. They're not very interactive. Some children with very, very high fevers, especially if it's above 104, are more prone to febrile seizures, especially young children. Any child less than 12 weeks should go to the hospital if they have a fever. That's just a general tip that you'll hear from your pediatrician. Fever and cough that doesn't improve and just gets worse, or if they have an underlying medical condition that maybe make them more prone to a complication. And in adults, it's very similar. Shortness of breath, pain or pressure in the chest or abdomen, dizziness, confusion, seizures, not making urine, muscle pain. So very, very similar to the things that you would find in young children. So I think, especially now more than ever, it's hard to say what is COVID symptoms and what are flu symptoms. And the issue is that it's actually really hard to tell the difference between the two unless you get tested. So Most of the basic symptoms with COVID-19 are the same as flu. So you can have fever, or just feel feverish, or have chills, cough, shortness of breath, difficulty breathing, feeling tired, sore throat, runny or stuffy nose, muscle pain, headache. You can also still have diarrhea and vomiting in COVID-19, same as the flu. The only really like sign and symptoms that's more common in COVID-19 is the change in or loss of taste and smell. You can actually get that in the flu as well. It's just not as common. Also, severity of COVID-19 tends to be more severe in more patients. Even though the flu can cause very severe illnesses, it's just not as common as we're seeing in the COVID-19 infection. Symptom onset also varies widely in COVID-19. So in the flu, like I was saying earlier, it's usually your symptoms kind of start 1 to 4 days after you're infected. With COVID-19, there's actually a very large range of when your symptoms begin. Really, they're seeing like 2 to 14 days after infection, you could get a symptom, like your onset of symptoms. And when I was working at Montefiore in the Bronx, I was actually seeing kind of a double spectrum where after 3 to 4 days, we get like a really bad illness. And if it wasn't within that 3 to 4 day period of a really bad illness, around day 10 to 14 was another time period in which you would see like a really bump in how severe the symptoms were. So it's kind of like your 3 to 4 day or your 10 to 14 day and very severe. And how they both spread. They both spread very similarly through respiratory droplets. However, the difference between COVID-19 and flu is that COVID-19 spreads much easier and much quicker than the flu. See. And then the same thing with high-risk groups, very similar risk factors, just going back to the previous slides, is who is at high risk. Very similar for COVID-19. The only difference is that the children of the younger children group, so the kids in the school age are at higher risk of an inflammatory disease, which is very rare, but it is possible. And that's the one group that's a little bit different than the flu group. And in the flu, much younger children are at higher risk of severe illnesses. And then in terms of complications, it's same as kind of we listed before. For these complications, very similar. The only additional thing that we see more commonly in COVID-19 are blood clots and the inflammatory. So it's multi-system inflammatory syndrome in children. That's the MIS-C. And then treatment-wise, for the flu, we do have antiviral medications, which is different than an antibiotic, but it is geared towards treating the flu. And I'll talk about that a little bit later. And in the hospital, we were trying a lot of different things. And then remdesivir, which is a monoclonal antibody, was being used in the hospital. I actually just read today, somebody just told me, and I started reading about it, that the FDA actually did an emergency approval for a new monoclonal antibody for patients that are not needing to be hospitalized, but aren't doing as well as some of the others that don't. They're basically kind of like an intermediate period where they're not needing to be hospitalized, but they're in a higher risk group. So now there's a new monoclonal antibody, but it's still technically in an experiment or like a clinical trial phase. But it is something to think about. If you are tested positive and you meet criteria, you may be able to get this particular medication. It was just approved this month, actually. And then prevention, very similar things. So social distancing, hand washing. Now we have the use of masks. The flu, we have the vaccine. We don't have a vaccine yet, but hopefully that'll be on its way. I think those are the major differences. And then the other thing that we also have to think about during this time period, is it cold or is it flu? Because that's another thing that's definitely going around at this time, and especially if you have young children. I have a 2-year-old, and he's in daycare and he's constantly having colds. And And I think the big differences between the cold and the flu, you definitely get more stuffy nose, sore throat, and colds. Chills aren't as common in the cold, neither are fever, and usually your symptoms are much more gradual and much more mild than flu in general. So treatment, and again, the biggest way to know whether or not you have the flu is to get a flu test done, which is very similar to the COVID test, where it is a nasal swab. But if you do end up becoming positive for the flu virus, there are antiviral medications, which are different than antibiotics. I listed them there. I'm not going to go through each one. There are different medications that, you know, have different indications and are better for certain patients and not others. And they have different time frames in which you would take it. So it's really best. So the best thing would be if you were to tell your provider, and that way you can get a test done, because really the medications work best less than 24 hours or less than 48 hours after your symptoms begin. Although in higher risk groups, we still will prescribe it because it's been shown to be beneficial in high risk groups, even if you start the medication after 48 hours. So the sooner you know, the better, because the sooner you can actually start the medication. The other things, kind of like clinical pearls. So the CDC does recommend, and that's the Center for Disease Control, recommends staying home until 24 hours after last fever. Stay hydrated, rest, avoid close contact as best you can with those in your home. Hand hygiene with soap, water, or if you don't have access to soap or water, with an alcohol-based hand rub or hand sanitizer. I also thought it was funny that they said if you have a small child, rest their head on your shoulder so they don't cough in your face. I don't know, I have a 2-year-old and he like coughs in my face. As much as I'd love that recommendation, I don't know how realistic that really is, but there you go. And then the big thing is prevention. So flu shots, really anyone 6 months and up, as long as there's no contraindications, washing your hands frequently. For young children, or like if they're in school or in daycare, sanitizing toys or like surfaces as best as you can. Teaching kids and adults, everyone can learn this, to cough in their elbow or sneeze in their elbow. If they use a tissue, to throw away their tissue so it's not sitting about and somebody else can come in contact with it. And for kids and adults to stay at home if they're having any symptoms of the flu, if possible. And then, as I was saying before, who should get the vaccine, flu vaccine? So anyone 6 months or older without a contraindication to the vaccine. And then certain age groups do require 2 doses. So, and usually that the age groups are, you know, that 6 months to 8 years. So really following up with your pediatrician to figure out if your child is in that group that requires 2 vaccines. So really it's being proactive in order to get your vaccine doses at the correct times, because you want to try to get both doses prior to the actual peak of flu season. So, because it does take 2 weeks for your body to fully make antibodies from the vaccine. So you have to keep that in mind with whether or not they require 1 vaccine versus 2. And for the most part, I would talk to your provider about what qualifies as a reason not to get the vaccine. So I think the most common, so I just wanted to go over some like the common questions about flu vaccine. So one question I get a lot are like, what are the side effects of the vaccine? So the 2 most common, there are the flu shot, and within the flu shot, there are multiple different types. But the most common reactions to the flu shot itself is a local skin reaction, so warmth or redness or swelling where you got the injection. You may feel tired. There could be headaches or sore muscles. You can actually get a low-grade fever. And then the nasal spray, which is a live attenuated virus, meaning it's a weakened virus that's made to only really work in the nasal passages. So you may get a runny nose, a headache, Some people may get vomiting or wheezing, sore muscles, low-grade fever. I think the big thing to note, like seeing this, you may say, well, why would I want a flu vaccine? But the symptoms that you would get as a side effect of a flu vaccine is going to be much more mild than if you were actually to get the flu virus. Another question, why every year? So basically it's because your immunity really decreases over time with this particular vaccine. And also the virus changes every year and season to season. So each flu season is going to require new and updated vaccines. So have to get repeated vaccines. This is a very, very common conversation I have. I got the vaccine, but I still got sick. So some common reasons why you still may have gotten sick or gotten the flu, even though you got the flu vaccine. So actually you may have been just exposed to the flu prior to receiving your vaccine. We know that it takes 2 weeks for your immune system to actually have enough antibodies against the vaccine that you got. So unfortunately, you go to the clinic and you're going to be around other people who may or may not be sick. There are 4 common strains, so there are basically 4 different types of vaccine or flu that they put in the vaccine. And this is based off of what scientists have looked at in the prior season, and they kind of have to make a educated and calculated guess as to what the strains are going to look like going forward into the next season. So there are so many different types of flu viruses that perhaps the kind that are in the vaccine in which you got vaccinated against is not the one that you encounter, unfortunately. And the other thing is the flu vaccine is not 100% effective, and it really varies depending on the match. As I was saying, the scientists really have to be able to get the correct kind of virus that's going to be in this current flu season and in that circulation period in that particular vaccine. And it's not always 100%. And even if it is a very good match, or what they say is like a good match year, also how effective the vaccine is going to depend on your age and your health status prior to getting the vaccine. And really, the people that do best with the vaccines are going to be younger adults or older children. And I should say older or younger, healthier adults. So if you fall in that kind of higher risk category, it still puts you at a higher risk of still getting the flu vaccine, even if it's a good match year and even if you get it at the correct time. So I kind of just wanted to look at, in prior seasons, we've had a very high incidence of the flu virus. And this is just a report from the CDC looking at how many people are coming into the office, outpatient office, so like where I work, complaining of flu-like symptoms. And this current season, the 2019-2020, is this green line here. So it's about the same as actually the 2017-2018 season, which I remember as I think I was in residency, which was a rough year actually. There were a lot of people coming into the emergency room sick with the flu. So the complaints are around the same and kind of similar to other seasons, but when we actually look at when people are getting tested, are they actually having the flu? This is also from the CDC. And New York City is here. We actually have a pretty low, and most of this US actually has a low incidence or minimal incidence of flu. And this is as of November 7th. So it's still a little behind, but we're doing pretty good. And that's probably in part because we are social distancing, we're wearing our masks, we're washing our hands. I think more people are getting the flu vaccine this year as well, except for Iowa. I don't know what's happening in Iowa. I don't know. Maybe somebody knows what's going on there. And then looking at New York in particular, I think we're around, here's Orange, and then this is Dutchess County. So this is up to November 7th. At least within that week in Orange County, there hadn't been a documented positive flu. And in Dutchess, let's see, it's 0.01 to 1.99 cases per 100,000 in population. So actually not bad at all. And really in part is probably because of all the COVID-19 precautions. So the big things and the big takeaways, I think, basically everyday actions can really decrease the spread of flu. And we're already seeing that because we're taking so many precautions with COVID-19. We're wearing masks, we're washing hands, we're staying home if we're sick, we're covering our nose and mouth if we sneeze. When you are out, try to avoid touching your eyes, your nose, your mouth, because that's how the virus gets into your system. Disinfect your surfaces that may be contaminated, get your flu vaccine, and speak with your provider early, as it could provide, it may be beneficial to get antiviral medication. And then for flu updates, I just put like the most common websites to look at. So the CDC, the Center for Disease Control, has a great website with a lot of information, and they even have like a flu command center and a COVID command center as well to get your daily updates about what the numbers are in the US, and the New York State actually has their own website and command center to look at the numbers.
Okay, so there have been some questions coming in while you
Sure.
were talking, Dr. Agcanas, so I'm just going to start. Is the flu also spread by aerosols or just by droplets?
So, I mean, if your respiratory secretions or respiratory droplets are aerosolized, then yes, potentially it could be transmitted that way. But it's a little bit different than, because sometimes there's a question between that and COVID-19, also the question about aerosolization. And I think we were just more cautious with COVID-19 because of how easily it was spread. So there was like a big discussion around if you have asthma, not using your nebulizer machine in the same home. There was concern for COVID, which is not the same as for patients with flu that have asthma. They could still use their nebulizer machine, and there wasn't a concern about spread that way.
What type of mask do you think the average person should be using and or wearing?
I mean, that's a good question. And, you know, I don't know the numbers of what people are wearing, but I've been seeing surgical masks, cloth masks, like the reusable masks. Even people have been using scarves, and kind of other contraptions I've seen. And it seems to be working, because when you're looking at the numbers of the incidents, besides Iowa, when I was looking back, like I said, this is the incidents, at least as of November 7th of 2020, this year. And everyone really all the states really have low to minimal positive flu cases.
Are there preventative vitamins to take to minimize flu?
It's never going to minimize flu, but for symptoms, similar, like I think people have heard about zinc and vitamin C being helpful with the flu.
What about zinc or elderberry?
Zinc, yes. There is some evidence that zinc can be helpful with reducing symptoms. Elderberry, I've never actually heard of being helpful. That's new for me.
All right. One of the local pharmacies in Cornwall actually recommend that, so I was just curious on that one.
Yeah.
Okay. Do blood tests actually differentiate between COVID versus flu diagnosis?
So it's a nasal swab, and what they do is they actually look for, they look for the DNA of the virus itself. And so I think maybe the difference that you're asking is the blood test for COVID, which is a little bit different, because then we're looking at, when we're doing a blood test for COVID, we're looking to see if you've made antibodies to the COVID virus itself. So two different things that we're looking at for those different tests.
Right. So the blood test would show if you previously had it and you had antibodies versus the nasal swab, which shows if you have it at that moment.
Correct. Because the nasal swab is looking for, do you have the virus right now?
How effective is the flu vaccine? Is it 80% effective, 90%? What has historically been the numbers? Because you hear about with the COVID, you
Yeah.
hear it's 90% effective, or they say 95% effective. What is the flu vaccine normally?
I think it's so variable because every season is different on how good they've predicted the upcoming season. So I don't have an exact number because I think each year has been or each season has been so different. At last year's season, so 2018 to 2019, I think they mostly calculated as the flu vaccine was shown to reduce the risk of having to go to the doctor by 40 to 60%. And then in 2018 to 2019, the flu vaccine prevented an estimated 4.4 million influenza illnesses, 2.3 million influenza-associated medical visits, 58,000 influenza-associated hospitalizations, and 3,500 influenza-associated deaths. And I do know last season there were about 188 pediatric deaths from the flu, and there has been none to date so far in this season.
So when we hear on the news that the COVID vaccine could be 95% effective, does that equate with the flu vaccine being maybe 80 or 85% effective? I just want to.
Yeah, like give or take each season, because some seasons, as they were saying, is a better match for they've gotten the right strains that are going to be circulating versus some years aren't as effective.
Thank you very much, Dr. Agcanas and Montefiore St. Luke's Hospital. To everyone who attended, we want to keep you healthy and well, and that's what we're here partnering to do. That's the important thing. It's better to answer your questions and be prepared for the flu season coming up.
Yeah.
So I want to wish everyone a very happy and a healthy holiday season. And Dr. Agcanas, thank you so much for spending the evening with us and our community. Thank you. Thank you, everyone who attended.
Thank you, everyone.